Good morning. I'm Angela. I'll be your nursing student today. I'm here to place your Foley catheter. How are you this morning? Okay, you're doing great. May I check your armband, please? Okay, your name and date of birth? Miss Twinkin, 1/1/1980. Perfect. Before I touch this patient, I made sure that I hand hygiene. I'm going to sit here and I'm going to ask, are you allergic to betadine? Are you allergic to latex that you're aware of? Do you have any pain? No pain. Okay, great. I'm going to move the bed up so that I can start assessing. Oh, I'm gonna hand hygiene again because I'm just that kind of person. My hands are always dry, but that's fine. I'm gonna do a little assessment. I'm gonna check. Let's just check the heart rate. I'm gonna also do a little examination. Make sure that there's no bladder distension of any ow of any kind. Ask my patient when the last time she voided. Was it painful? And she's gonna give me the answers that she can. And I'm going to try to set up everything for her and let her know that you're going to feel a little bit discomfort for the most part, but I will tell you when to bear down as I'm inserting the catheter. Do a hand hygiene again, put on some plastic disposable gloves, not the sterile ones, and we start the position. I've already moved her up. I'm going to inform her that I'm going to have to put you in a certain position. I've already looked at her chart, so I know she hasn't had any type of hip or knee surgery. However, I will ask her, does she have any pain? My mom's one of those people that you can ask her 50 million times and she'll forget. Not that she has dementia or anything, but she's one of those people, she don't want people to know that she's weak. So now I ask again. So I just want to let you know, Miss Twinkin, we're gonna have to move your legs in a certain way. And if she says, "Oh, it's fine, I don't have any pain," we'll proceed. I'll make sure the room is private. No, that modesty is taken into consideration. I'm gonna have one. I don't have another sheet. You know what I'm gonna use? I don't have another sheet. That's kind of. Oh, that stings. Anyway, let me use this towel. All right. For modesty, we're gonna pull this one down here, and we're gonna put this one on, and we're gonna position Miss in a certain way. In the froggy position. My kitchen towel. Once again, ask her if she is comfortable. If she is comfortable, then I'll proceed with bringing my stuff over in between her legs. And I think that will be easier for me because I have easier access. I'm gonna move the bed up because I'm kind of tall, and that's for my safety as well. So the bed moved up. I don't. If I move this, I won't be able to see it. But anyway, I would normally have my stuff here, my sterile stuff, maybe about right here, because I don't want his little feet to kick my stuff off. So I would have it about right here. Then I will sterilely try to pick up this little sheet that comes with it. It's shiny side down. This bad boy will go under the buttocks area. You gotta realize that this is a small teddy bear. In normal circumstances, it will go under, and there will still be space for me to place my sterile supplies. Okay, this is when I will take off the disposable gloves. I'll hand hygiene again, put on my sterile gloves, and then I will proceed with letting her know that I'm going to clean her. All right, everything's at the end, but I don't have enough space. And I'm going to take everything out with my gloves. I've already I put on sterile gloves. I want to make sure I throw that out there. Hand hygiene, I put on sterile gloves. And I'm separating the sterile kit. And I'm making sure I have everything in it. I should, but in a perfect world, sometimes things are missing. I've asked her, does she have a latex allergy? Just for precaution, I found her a latex free. She doesn't have any allergies. I've also asked, is she allergic to shellfish or betadine? She says no. Perfect. So I'm in one little spot. I'm going to put some betadine. Let's see. I'll show you the tray. Right? This is my 10cc. Let's say I'll take everything out. I'll push everything to the side with my glove hands, and I'll put the betadine here. Okay? All right. Miss Twinkin, I'm going to start cleaning you with this solution. It's going to be a little cold, but it's for precaution so we can make sure that everything is clean. Okay? So with this I'm on her right side because I'm right-handed, and this is my non-dominant hand. Of course, we have to go and look for things, and we're going to clean from front to back. I just do one demonstration from front to back with each cotton ball. We're going to do one side, the other side, and then down the middle. Once again, front to back. While we're there, we can just kind of take a look-see of the area between the vagina and the anus. I always pronounce that word wrong. I need to learn how to... Perineum? Am I saying that right? Perineal? I don't know. I'm going to look it up. Sorry. I need to practice my pronunciation on things. Okay, so we've gotten to that part. Like I said, I've set everything up. I've got the betadine in here. I've also uncapped. I can do this with one hand. I wouldn't advise it. But I could take one hand and unscrew or pop it off. Put my KY jelly in a little reservoir. I'm going to attach my syringe with my right hand. I could have done this beforehand, but I've already touched the patient, so now, boom, it works out, surprisingly. So the tip is lubricated. Patient has been cleaned. Next thing I want to do is I want to bring the box closer, because like I said, it's at the end of the bed, but I'm going to scoot it sterilely closer to the patient. It has the KY lubricant on it, and we're going to insert until we get some urine. So we see urine. Then we're going to push it in another, I don't want to say 2 inches, but yeah, women are different than men, so you got to be mindful of that. Urine return is what it's called, sorry. Okay, once that happens, it is now in this twinking. The box says that it's supposed to be 4 cc's of this saline in order to inflate the balloon. So of course we're going to do the 4 as recommended. So from 10 to 6, the balloon is now blown up, right? And to double check, I'm gonna do a light little tug. Okay, we're gonna take this off, this little trusty syringe, throw that off. Now we're gonna take it out of the box, right? It's placed in and carefully unravel it. So now that it's already in, as it should, you don't want to start touching stuff. At this point, you can take your sterile gloves off, put on hand hygiene, put on a pair of gloves, and now you can start manipulating and hanging this in a way to where it doesn't kink on the patient. You have this little handy dandy little hook thing that you can hook onto, and then you want to hang your bag, your actual bag, below your patient. And there's a little hook on the side that you can kind of hook to the bed, but you want this below. And you want to make sure everything's clear, because you don't want any backflow that causes infection. All right, let's see. Now we fast forward. The Foley has been in the patient for X amount of time. It's time to take the Foley out. Once again, oh, I'm sorry. I missed a part. Before I take the Foley out, we have to redo everything. So we're going to take off everything with my newly gloved hands, and we're gonna reposition. We're gonna take her out the froggy legs. Ask her again, is she comfortable? She's gonna probably say no, because I wouldn't be. And we're gonna reposition her and make everything nice again. Gather up all our stuff. Remove this from under her. Take it away. Remove that from her, and we're gonna make sure that she is okay for the most part. And that should be it for the insertion. I was about to skip over that part. For the insertion part, we want to make sure that the patient's legs are back to normal. They're comfortable. Their original blankets are back on them. And I mean, if you want to assess after, then it's up to you. But you want to make sure that there's no pain. That's the main thing. So once again, hand hygiene. Ask the patient again, are they okay? Tell the patient, if you need anything, you'll be right outside, and that'd be that. Okay, so now we are fast forward to now we need to remove the Foley. So we're going to come into the room once again, and we're going to greet the patient. Hi, Miss Twinken. How are you? Check her armband. We're going to assess her, check her vitals and things. Once again, check for distension. We're going to also put on some gloves after we hand hygiene. And once again, we're going to pull up. We're going to let her know, hey, I'm in here to remove the Foley catheter, and to just make sure everything is okay. Are you having any pain? Okay. Did you have any difficulty when using the Foley? No, you did not. Okay. All right. So, once again, take those gloves off, hand hygiene. Because you're taking it out, you don't need the kit again. I mean, if you want to use sterile gloves, I personally would, but that's just me. But anyway, hand hygiene, put some gloves on. You want to make sure you have an empty syringe. While you're there, putting the patient in frog legs again, making sure that she's not in pain, asking questions as usual, because things can change. And if she says that everything is fine and you can proceed, once again, you're going to put your modesty, cover her up, push that down. You can get a chuck pad at this point. And the chuck pad has the same concept of you put the blue side down with a chuck pad, which is equivalent to the shiny side. You're gonna pull everything down, and you want to make sure you have your syringe, and explain to her what you're going to do. You have your syringe. You can put your you have it positioned. Hand hygiene. Put on some gloves. I feel like you should put on sterile gloves. I'm gonna put on sterile gloves just in case. You know what I mean? You are touching that area. But then again, you have to check the skin integrity. Excuse me. You want to check for wetness. You want to check for skin breakdown between the vagina and the anus. So I don't want to show that on camera, but you get the gist. We're going to check the area. If there's nothing to be concerned about and everything seems normal and there's no breakdown, there's no wetness, and it seems like the Foley was placed correctly and there was no problems with the Foley, then you can proceed with taking the Foley out. You want to deflate the balloon, and you want to tell the patient, once again, as I remove, you might want to bear down, as I remove the Foley, you're going to feel a little bit discomfort. So, just for precaution, it says to, I'm not going to remember, because this is going to be another random patient, but if I remember this patient, I know it was going to be 4. But I'm just going to, you just do it, and you remove the air, and you pull it. This is weird. Pull the air out. Guess it makes sense to just pull it all the way. I don't know what's going on with it. Oh my god. Alright. Alright. For some strange reason, it doesn't want to do what it's supposed to do. And you are, once again, you want to check the bag. There's nothing, like I said, you want to check everything before you proceed with removing the catheter. If there was no kinks, there was no backflow or anything like that, you can proceed with it. I was supposed to do that before I deflate the balloon. So anyway, moving on. You're going to slowly remove the catheter. I would personally hold it up like this because I do not want pee-pee in my face. And you're going to take the catheter with your gloved hand, and you're going to unsnap it. I'm pretty sure, I don't know if they want to keep it. They say they do. I don't know why they would. But take it and put it into like the red bag or whatever the facility says that you're supposed to do when it comes to bodily fluids. You would think the red bag. Anywho, once again, you're going to change your gloves. You're going to hand hygiene, put on some more gloves, and this is the process of, once again, you're going to check the patient again. Make sure you have like some gauze, because as you're pulling out, what's going to happen? Urine might flow out, so you want to have like a wet and a dry. Make sure you clean that area up, because once again, you don't want any type of urine or anything to break down the skin in that area that the patient's not aware of. So you're going to remove your little chuck pad. Once again, you're gonna ask the patient, you know, Miss Twinkin, how are you? How you feeling? Okay, you feeling good? All right, that is wonderful to hear. You're gonna remove the frog legs, place her back into what's comfortable for her, and then you're gonna pull a, once again, keep checking, make sure everything's everything. Pull her blanket back up, reposition her, help her reposition herself, what's best for her, what makes her feel comfortable. Put the bed back down, put the bed rail up. I forgot to mention that when I put in the Foley, of course, that goes without saying. So anyway, you're gonna put the rail back up. Take off those gloves. You're gonna hand hygiene once again, and you do your closing, which is you're going to once again ask the patient if they're in pain, how are they feeling, and then let them know that you will be right outside, or you'll be available for them. Either you or another nurse will be available for them, and you hope that they have a wonderful day. You document anything that you see that's not normal, so that way when the next nurse comes in, they can see, as well as when you give them report, anything that you encountered that was abnormal. And that's pretty much, I think, it. This was 16 minutes long.